All right, welcome back. Time now for our weekly check-in on infectious diseases with Dr. Isaac Bogoch, infectious diseases physician and specialist at UHN. Dr. Bogoch, always great to see you. How's your summer going?
So far, so good. Too short, but you know what? We still got a lot of August.
We do.
So yeah, it's going well.
We do have a long runway, and it is hot outside. All right, let's talk about hepatitis A. I know we touched briefly on this, but with Toronto Public Health opening a walk-in clinic for hepatitis A vaccines after a possible exposure at a local restaurant, what do people need to know about how Hep A spreads, who's most at risk, and how effective the vaccine is if you've potentially been exposed to it?
Yeah, so kind of gross to think about at 7:20 in the morning, but hepatitis A is a viral infection, and it spreads through what we call the fecal oral route. People who are infected with hepatitis A shed it in their stool. With poor hand hygiene or improper hand hygiene, you can inadvertently spread it to others if you're preparing their food. You can spread it to others sexually as well. And it causes a very severe infection in adults. Kids don't get that sick. Adults can get very, very sick. It doesn't tend to kill people, but people will feel extraordinarily unwell. Fortunately, it's vaccine preventable. The vaccine is extremely effective. It lasts for decades, probably even lifelong. And if someone's had an exposure to hepatitis A, if you get the vaccine fast enough, sooner the better, but you have about a 2-week window, you can significantly reduce the risk of getting this infection.
Okay, and what are kind of the symptoms? Like, what tells a person, oh my gosh, I think I have Hep A?
Well, for starters, if there was a known exposure, that's a significant clue. But really, people will have fever. They'll have pretty bad abdominal pain, and sometimes the liver dysfunction is significant enough that you can get jaundice, meaning you can get a yellowing of the skin and a yellowing of the whites of the eyes. But people will have some pretty significant abdominal pain, nausea, vomiting, fever. They'll feel very, very unwell. And it's an acute illness. It's not going to be like that for forever. The vast majority of people tend to get very sick and then recover. But again, no one needs to go through this. It's a vaccine preventable illness. If anyone had an exposure, they should go to those clinics right away to get one of those hepatitis A vaccines.
Okay, good to know. So we are in the thick of summer. We've seen beach closures this summer due to high E. coli levels. How risky is it to swim in contaminated water? And what types of infections should people watch for after swimming in lakes, pools, or even splash pads?
Yeah, well, for starters, I mean, you know, Toronto has some incredible beaches on Lake Ontario. They're clean and they're gorgeous. But of course, because it's right next to a big city, there can be times where the E. coli levels in the water are too high, where it's just not advised to go swimming. Usually that's after large rainstorms. But again, there's other factors that can cause large E. coli or high E. coli levels in the water where it's just not advised to go swimming. What can happen? Well, you can accidentally ingest the water and you can get a gastrointestinal infection. You can get, people might have a small abrasion or cut on their skin, and you can get skin and soft tissue infections. It's just not advised to go in when the E. coli levels are high. Having said that, the city of Toronto does a really good job in marking the beaches, and you can go online, you can see what the E. coli levels are, which beaches are safe, and which aren't. And of course, it's dynamic. So sometimes one beach is perfectly safe to wade into the water and swim. Other times it isn't. So it's really easy to go online and check to see which ones are safe and which ones are not. But there's some really beautiful beaches in Toronto, clean and gorgeous.
Yeah, take advantage while you can. Dr. Bogoch, unfortunately, we've run out of time. I wanted to talk about the flesh-eating screwworm, but we'll save that appetizing discussion for another day. Thanks so much for your time this morning. Have a great week. We'll chat soon.
Thank you, Jennifer.